This is a CJASN podcast, and I'm Zoe Thomas from McGill University. I've been invited to share the main points of our recent feasibility trial of brief mindfulness meditation for depression and anxiety symptoms in patients undergoing hemodialysis. Rates of depression and anxiety symptoms are prevalent in hemodialysis patients, reaching up to 50% of this patient population. However, access to traditional treatments is generally inadequate due to low detection, polypharmacy, and the need to eliminate additional appointments. Our team was interested in evaluating whether brief mindfulness meditation might represent a feasible therapeutic option. Mindfulness meditation allows patients to enter into moment-to-moment, non-judgmental awareness and has been proven effective for many psychiatric illnesses and for distress associated with chronic medical conditions. In 2016, we recruited 41 patients with depression and anxiety symptoms from a hemodialysis unit in Montreal, Canada. We randomly allocated our participants to two groups, either an 8-week course of brief meditation or treatment as usual. Those in the meditation group were guided through a 10 to 15-minute mindfulness practice by a trained therapist 3 times a week during hemodialysis. At the end of the study, 71% of patients randomized to meditation completed the trial, and participants reported enjoying the meditation, rating it as 8 out of 10 on average. They said that meditation had given them courage, hope, dignity, and self-confidence. Nevertheless, we observed several barriers to providing meditation in the hemodialysis setting, namely unexpected shift changes, interruptions, space constraints, and participant fatigue. When we compared participant scores on depression and anxiety scales before and after the study, we did not find any statistically significant differences between those who had received meditation and those who had not. However, we did not enroll enough participants to draw any firm conclusions. In summary, mindfulness meditation appears to be feasible and well tolerated in patients on hemodialysis with depression and anxiety symptoms, but larger studies are needed to clarify its efficacy. I would like to thank CJASN for inviting us to share our research via this podcast.
This podcast is copyrighted by the American Society of Nephrology, all rights reserved. All content in this podcast is for informational purposes only and is not intended to be medical advice. This podcast should not be used in a medical emergency or for the diagnosis or treatment of any medical condition. Please consult your doctor or other qualified healthcare provider if you have any questions about any medical condition or before taking any drug, changing your diet, or commencing or discontinuing any course of treatment. Thank you for listening to this podcast of the American Society of Nephrology.